Professor Dr. Humayun Bulbul, Principal Dhaka Dental College and President Dhaka Dental College Teachers Association, as well as Secretary General Bangladesh Dental Society. Hello, sir. Assalamu alaikum. How are you?
Walaikum assalam. I am okay. Please
Okay.
continue.
Our respected welcome speech, Professor Dr. AFM Sarwar sir, Vice Principal, Dhaka Dental College, and vote of thanks will be given by Dr. Anupam Podder, Head of the Department and Associate Professor, Department of Periodontology. Hello, Professor Afam sir, do you hear me,
yes,
please?
Sir. Yes, sir.
Dr. Anupam Podder, do you hear me? Hello?
Yes.
Okay, fine. Welcome to you all. I am Dr. Morshed Talukdar, moderator of this program, associate professor and unit head oral and maxillofacial surgery, and Secretary General Dhaka Dental College Teachers Association. We have a learned panel of expert panelists, Professor Jalaluddin Mahmood. Sir, do you hear me? Ex-head of the Department of Periodontology, Dhaka Dental College. Our another learned panelist, Professor Dr. Jahid Hussain, Department of Preventive Dental Science, Najran University, Saudi Arabia. Professor Jahid sir.
Hello. Yes. Good evening.
Assalamu alaikum. Welcome to your seminar.
Thank you.
Our another panel of expert, Professor Anirban Chatterjee, ex-professor and head Department of Periodontics and Implantology, the Oxford Dental College Hospital.
Thank you.
Bangalore.
Thank
Sir,
you.
Professor Anirban sir, welcome you to our seminar. We have another panel of expert, Professor Dr. Balaji Manohar, Principal, Professor and Head, Department of Periodontology, Kolingo Institute of Dental Science, Bhubaneswar. Sir Balaji.
Good evening. I'm fine.
Good evening.
I hope everybody is fine.
Thank you, sir, for your nice response. We have, at last, not the least, Professor Dr. Humayun, Professor and Head, Department of Periodontology and Oral Implantology, Kathmandu University School of Medical Science. Sir.
Hello. Good evening.
Manoj, good evening. Welcome to our seminar. Thank you all. Now, today's topics: an introduction to the aesthetic and functional basis of the Smylist concept. As you know, Smylist, a dentist, a orthodontist, a periodontist, endodontist, just like a Smylist is a smile specialist. This smile is a person's greatest beauty asset. As you know, a defective smile might be considered as a physical handicap, as the mouth and as a focal point where a large share of attention is directed towards mouth and teeth. It would be nice to have some sort of tools to assess beauty, which currently does not exist. These are the latest concept of our smiling and its design. So Smylist, it is a smile specialist like orthodontist and endodontist. So I would like to request our opening speaker, Professor Dr. AFM Sarwar. Sir, do you hear me?
Yes.
I would like to request to deliver your speech as an opening speaker. Welcome speech.
Assalamu alaikum, ladies and gentlemen, who are watching this live webinar through Facebook by the support of Axis Dental School. We know that a smile is the person's ability to express a range of emotions, so it can often determine how well a person can adapt to the society. It is our pleasure to welcome everyone, though in a short welcome address already have been done, but I am just introducing each and everybody again to our beautiful virtual platform of Dhaka Dental College Teachers Association. We are so glad to have you all here now. We appreciate your virtual presence in this global COVID-19 situation. We would like to extend a special welcome to our chairperson, Professor Dr. Humayun Bulbul, Principal Dhaka Dental College, as well as the President Dhaka Dental College Teachers Association and the Secretary General Bangladesh Dental Society. Along with our honorable speaker, Professor Dr. Ajay Kakar, he is a periodontist and implantologist and acting as an adjunct faculty, Mahatma Gandhi Mission Dental College, Panvel, Navi, Mumbai, who will be delivering his topic title and introduction to the aesthetic and functional basis of Smylist concept.
Thank you so much.
We are so excited to have you all panelists as Professor Dr. Jalaluddin Mahmood, Nipu Bhai. We are in Bengali, his brother is called Bhai, so that he is our honorable senior Jalaluddin Mahmood Nipu Bhai, ex-head of the Department Periodontology and Oral Pathology, Dhaka Dental College. Professor Dr. Zahid Hussain, he is working in the Division of Periodontology, Department of Preventive Dental Science in Nazran University of Saudi Arabia. Along with us, Professor Dr. Anirban Chatterjee, everybody knows him, ex-professor head, Department of Periodontics and Implantology, the Oxford Dental College in India, Hospital and Research Center, Bangalore. Professor Dr. Balaji Manohar, Principal Professor and Head, Department of Periodontology, Kalinga Institute of Dental Science, Bhubaneswar, Odisha. Professor Dr. Manoj Himangain, Professor and Head, Department of Periodontology and Oral Implantology, Kathmandu University, School of Medical Science, Nepal. We are also excited to get to know our few faces here from our above mentioned panelists with our anchor, though now she is not here, Dr. Kamrun Shumi, Assistant Professor, Department of Conservative Dentistry and Endodontics, Dhaka Dental College. Moderator, acts as a moderator of our this webinar, Dr. Morshed Talukdar, Associate Professor and Unit Head of the Department of Oral and Maxillofacial Surgery, Unit 4, and Secretary General of Dhaka Dental College Teachers Association. And finally, we welcome to Dr. Anupam Podder as a Program Coordinator, Associate Professor and Head of the Department Periodontology and Oral Pathology, International Affairs Secretary, Dhaka Dental College Teachers Association. Lastly, let me introduce myself. I am Dr. AFM Sarwar, Vice Principal and Head of the Department of the Children Preventive and Community Dentistry, Dhaka Dental College. Along with us also, Professor Soed Morshed Molla is from Chittagong, and our Jasmine Haq, then Abul Kalam Juwada sir was one of the most founder of this periodontology in Dhaka Dental College. He is also with us. We know the patient's face and the personality is often reflected through his or her smile. According to this philosophy, a person's smile begins with an expression of face. Excessive gingival display or gummy smile is a growing concern to dental patients and often considered detrimental to an aesthetics. So, smile design is an appropriate treatment. Periodontitis is the developing of untreated gingivitis and is a more serious gum disease. As a result, it can the reason to lose one or multiple teeth. The early diagnosis of periodontal disease will lead to the best treatment possible. It maintains the health of the tissue supporting the teeth called periodontium and is prerequisite for the healthy mouth and good smile. Without periodontium, a man or woman cannot give a good smile. Achieving a successful, healthy, and functional result requires an understanding of the interrelationship among all of the supporting oral structure, including the muscles, bones, joints, gingival tissues, and occlusal. So, no more now. I am requesting our honorable moderator, Dr. Morshed Talukdar, for continuing the webinar. Later, a webinar to be continued. Thank you all. Thank you, everybody. Do you hear me, Morshed Talukdar?
Thank you. Thank you. Do you hear me, everybody?
Yes, sir. Welcome.
Thank you, sir, for your nice and excellent welcome speech on this webinar. You are rightly mentioned, smile as a smilist. A smile is a person's ability to express a range of emotion with the structure and movement of the teeth and lips. Smile has been classified as a high, average, low by Tijan et al. High smile shows complete display of cervico-incisional length of the maxillary incision along with continuous band of gingiva, whereas low smile has less than 75% of display. So thank you very much, sir, for your nice and excellent presentation. Now I would like to request our honorable speaker of this seminar regarding an introduction to the aesthetic and functional basis of the Smylist concept. Professor Dr. Ajay Kakar, sir, do you hear me? Hello?
Yes, I'm
Hello.
very sure. I've unmuted myself. I'm ready to start my presentation whenever you say so.
Thank you, sir. I am requesting you to present your presentation.
Okay, I'm going to start sharing my screen now because I will
Okay.
also be showing slides along with my lecture. So just give me a moment in which I will share my screen and start off. I'm going to show you two presentations today, essentially. One is an introduction to the introduction. And the second one is the whole concept which I'm going to try to teach as much as possible in this presentation. So I've just started my PowerPoint slides over here. And now I'm coming back to my Zoom window
Okay, sir.
to share that screen. Okay.
Okay, sir. Okay, sir.
Here we are. Share. I presume you all can see a sort of black screen right now. Okay.
Okay, sir.
Objective.
Is my screen visible to everybody?
Sure. It is very much
Yes, sir.
visible.
Okay.
Nicely
Yes, sir.
visible.
Great,
Yes,
great.
sir.
Now let me give you my journey into Smylist and what Smylist is all about. I'm quite sure right now that most of you would not have had experienced Smylist up till now because it's a relatively new concept in dentistry, relatively new concept, as I said. I myself was first exposed to the early beginnings of Smylist approximately 7 or 8 years ago. And that time I did not really consider it much because it was just a fleeting thought which was presented to me rather than a concept. About approximately 3.5 years ago, that I was totally exposed or learned about Smylist, and that has completely changed my professional world, my professional career, my approach to dentistry, and what I want to do with dentistry. Now, how did this happen? This happened because I used to, along with my wife, Dr. Mona, who is more of the aesthetic dentist, I'm more of the periodontist, and a little bit of implants here and there, which came in much later in my life. Still, I'm essentially a periodontist, primarily a periodontist, wanting to save teeth rather than putting implants. I'm sure Balaji and Anirban and all of you periodontists over here will echo the same sentiment as I do, so that we want to save teeth first rather than put implants. But moving from perio to implants, the world of Smylist completely fascinated me. Now, what is Smylist? Who created Smylist? What is it all about? It all started because I was accompanying my wife to the European Society of Cosmetic Dentistry annual meeting. And this meeting was taking place in Paris, in France. So I just accompanied her for the conference. I said, yeah, let's pick up some new ideas and thoughts over there. And that's when I was first introduced. I came across and met a fascinating person, Dr. Maria Csillag. Dr. Maria Csillag is from Budapest, Hungary. She's a dentist, went on and did her post-graduation in restorative dentistry, and then went on and did some more advanced studies in Hungary and Sweden, a combined program, and then started her practice in Budapest, Hungary. Now, it's very interesting that when I met her first time, she got interested in talking to me because of my extreme interest in computers. Computers is my passion and hobby other than doing dentistry. I am almost a completely professional software programmer. I've developed a lot of software programs for other than dentistry. Of course, I've done for dentistry also. I've got a complete office management software package, which is used by a number of dentists all over India. So it was my fascination and my understanding and interest in computers that got Maria Csillag talking to me in Paris, because she was playing around with developing an aesthetic software. And so she started talking to me over a dinner that night. And as we were talking and what she was wanting, I felt that she is too ambitious. I thought that all that is not possible on a computer, because I considered myself to be quite an expert on software development, having done so much software programming over 20 years. So I did not really honestly take her very seriously. Well, she was determined in doing it. So we meet again at the next EACD conference, and there she shows me something. It was only talk before in the previous year, and this year she showed me something, and I was quite fascinated to see what she was showing me. I said, wow, I thought this is not possible, and she's made it possible. Now, she is not a software programmer. She doesn't do any coding. She knows how to use a computer. So she got hold of some software programmers and gave her concept and said, I want this to happen. And those software programmers made that happen. So that was what I liked about her. So 3.5 years back, I was invited to do and create a dental education program, CDE program in Dubai. So I was, of course, invited. My wife was invited, and they asked me, could I get somebody from Europe? So I said, okay, let me talk to this lady, Dr. Maria Csillag. And she accepted the invitation to come to Dubai. So she came to Dubai. I was there in Dubai. Mona was there. And we did a full day workshop for her. I was doing a workshop on perio. Mona was doing on endo and aesthetics. And Maria did a full day workshop on Smylist. So naturally, since we were there, I was sitting and listening and hearing. And what I heard that day completely changed me as a dentist. Subsequent to that, I called Maria over to India for the Indian Academy Aesthetic Cosmetic Dentistry Conference, started talking to her about it. She was a keynote presenter. I called her a second time, a third time, a fourth time, and a fifth time to India. We conducted workshops on Smylist. And since then, I took a group of Indian dentists to Budapest. Then I went to Budapest, at least I've been there 8 times in the last 3 years, working with her on this Smylist concept. And every time I go and meet her, I learn something more. Now, what is this Smylist all about? What was it that fascinated me so much that I thought dentistry is turning it upside down? Let me just briefly run you through about 5 or 7 slides to understand the gist of Smylist, and then I'll get into the details of it. So basically, Smylist, I tried to create and package her whole thing into as many few words as possible. So I said, Maria, what I can say, your whole brilliant, innovative, original, single-handed concept, I would divide into 2 parts. The first part is objective aesthetics. When I say objective aesthetics means, now aesthetics is considered to be a completely subjective concept. One person, one heroine looks very beautiful to one person, but may not look as beautiful to another person, and may look okay, very simple to a third person. So it is considered that beauty is in a way subjective. But she pointed out, no, beauty is not subjective. And I said, okay, beauty is not subjective. So what is the objective aspect? And since we are dentists and we don't deal with the entire body, we were working on the teeth. So she created an objective aesthetics with an extensive set of rules to define what kind of smile should be created for anybody. And she gave mathematical formulas for it. She gave me the logical reasoning for it. And that fascinated me because I've been involved with aesthetic dentistry for close to 14 years. I'm the past president of the Indian Academy of Aesthetic and Cosmetic Dentistry. In India, we have gotten every known aesthetic dentist of the world to come and lecture at our conferences. And here was somebody telling me completely, radically different things, but they made absolute rational, logical sense. So I was totally thrown off. I said, how come there is nobody else in the world who thought of these things? And that set me off thinking. And then she coupled it with something called rational function. He says teeth cannot be just good looking. Teeth also have to function. And the role of teeth, she has expanded way beyond we can ever imagine. I'm going to touch upon all those things as we move ahead. So there was rational functional, which was applicable for all kinds of rehabilitative techniques. Now we do a lot of full mouth rehabilitation in my private clinic. And we just realized that our full mouth rehabilitation should be expanded at least by 300% to incorporate all the principles laid down by this lady, Dr. Maria Chillag. So here was a blend, and I could not find this anywhere else. This was the only such blend of aesthetics and function where the two were merged together and have to be living in symbiosis with each other. Now, all her thoughts, she had to give it a name because the thoughts were so original and different. So the name given to all her thoughts was something called Smylist. She just named it. Smylist is just a name. Just the way my name is Ajay and Anirban is Anirban and Balaji is Balaji. These whole concepts is Smylist. So she named it Smylist, and it shows the logical connection between the mandible, and now here comes the first major paradigm shift. You can see it on your screens. The first logical connection between the mandible and the rest of the body. It was quite fascinating for me that how could the mandible have such an important role with the rest of the body? Now, it was not just theory that she showed me. She gave me so much proof and evidence that I was completely flabbergasted. It is a definitive system which she showed me that how the mandible, if not balanced, will cause headaches, will cause neck aches, will cause backaches, will cause knee aches, will restrict hand movement, will completely screw up your posture, and so much more. I'm going to touch on all those things as we go on with this presentation. Now, this is the key. This is the key to what the whole concept is about, that the maxillary teeth and the maxillary teeth define where the mandibular teeth can sit. Because if the maxillary teeth are not, the occlusal plane of the maxillary teeth is not in harmony with the skeletal system, then the mandible cannot go to its rightful place, and it leads to a complex cascade of events. So let's just see a little bit of what this is. So she suddenly came up with the thought and showed me the evidence that how you can deprogram a mandible which is not in the right place and record what she calls a Smylist bite in a matter of few minutes. And you know what I was doing in my clinic for deprogramming? Deprogramming was a 3 to 6 month event. It took 15, 20, 25, 30 visits to the office to do conventional deprogramming. And when I say conventional deprogramming, it's not just in my office, everywhere in the entire dental world. Deprogramming principles primarily laid down by Dawson and expanded in that whole method by a number of other people. There are about 7 or 8 different forms of conventional deprogramming. All of it involves a splint, a device, a prosthesis which is put in the mouth, adjusted over periods of time to achieve deprogramming. And Maria says, you don't need to do that. I can do it in 15 minutes. I said, come on, it's not possible. And she showed it to me. I will show you the evidence of one of her students having done a deprogramming and see the result on the patient. We'll see it a little later. So I was completely thrown off. Here is something which was totally crazy for me. And to make all this possible, she created something called as the Smylist aesthetic software, which is what first got her interested in talking to me, which virtually or digitally designs an objective aesthetic smile with the function built in, and which allows fantastic smiles to be created, which makes patients look younger, which makes patients function much better. Now, what are these pictures I'm showing you? All these pictures are used to define how teeth should be looked or should be made or designed. And along with the basic aesthetic software, she created a laboratory software which would take that digital smile and convert it into a real smile for the patients. So here was something totally unheard of up till now. And we started the first case that we tried to do with Smylist. It was quite fascinating for my office because we finished it in 4 sittings. Yes, 4 visits to the clinic and a full mouth rehab along with the smile design was completed, 28 teeth involved. It's quite crazy. So what I call it, that the future of dentistry is now with Smylist. It is turning the world of dentistry upside down totally. And now let's see what this upside down thing is doing. I've stopped the screen sharing because I'm not going to open a full presentation. Now, what I would like to request everybody is, feel free to stop me at any point of time, ask as many questions as you want, because it is going to be totally new. You're going to be, let's say, shocked the way I was shocked on hearing all this. So you may want clarifications. So please don't hesitate to pause me at any point of time. In fact, I enjoy even if all my viewers can ask questions in between, but since I don't have a connect with all the viewers because it is a live broadcast, at least I have a connect with my panelists and all of you learned teachers over here from Bangladesh. So please stop me, pause me, ask questions on behalf of the viewers or on your own basis. If you want to understand anything, do not hesitate to stop me and ask me questions. So I'm going to now share the next screen. So friends, this is Dr. Maria Chilak. She's the one who created this whole concept. She is all of 45 years old. She has got approximately 22 years of dental experience as a practicing dentist. And in these 22 years, she has turned dentistry upside down. And we have a number of published articles to give the proof or evidence of what she talks. So let's just move ahead. Whatever I'm talking today is not mine. I have not created it at all. This whole thing is a creation of Dr. Maria Chilak, who is now a very close personal friend with me. Now, these are the countries where Smylist has gone. And today I'm very happy that I'm going to put a dot on Bangladesh. And it's me who's putting the dot on Bangladesh because now Smylist comes to Bangladesh also, which is a very proud moment for me. And I have to thank Dr. Anupam Podder and all of you here to letting me come and talk on Smylist. This is the only blend of aesthetics and function, as you see over here. The aesthetics is taken, blended with the function. Now I'm going to talk about a little bit of aesthetics, and then I'm going to talk a little bit about function, and then I'm going to show you how the two merge together. Certain fundamental bases for the Smylist concept. The first and foremost basis, which somehow in dentistry we never follow or never think about, is that the maxillary teeth are fixed in the skeletal system. We cannot, unless we're talking about ortho or something, but on a day-to-day basis, we cannot move the maxillary teeth. They are not mobile. They are a fixed entity of our skeletal system. The mandible is the only bone in the body which moves bilaterally. There is no other bone. It is the most unique bone. It's the first and the topmost mobile bone of the body. It comes above the arm, which is mobile. But before the arm comes the mandible. The mandible is the mobile part. The mandibular teeth move. What I'm doing now. The mandibular teeth move. And the mandible for its movement is controlled or fenced or bordered by the maxilla. And that's the reason Maria said, what we need to do is ensure that the maxillary teeth are in harmony with the body and just make the mandible follow the maxillary teeth. If the maxillary teeth are not in harmony with the skeletal system, any amount of work on the mandibular teeth is not going to work. It's not going to function. And it will lead to an imbalanced mandible with disastrous consequences. Now let us see how this happens. This is Maria herself. There is aesthetics, there is function, and with the aesthetic and functions comes a face diagnosis. And then comes something called as posture diagnosis. Now you'll have to believe me now, the evidence will come very shortly towards the end of my presentation that the posture of a person is greatly dependent on the mandible, which is completely dependent on the maxillary teeth. So if you don't have the two in harmony, you're going to have problems. All this is merged into the Smylist software like this with a defined set of rules. The face has got, what Smylist does is, it takes the face and geometrically maps it. Of course, such geometrical mapping has been done by others. But nobody has taken the geometrical mapping and defined it into rules which will define the anatomy of the maxillary teeth. Now, this is something interesting. For example, this is just an example. The entire Smylist thing takes about a 4 to 6 day workshop to teach. I'm going to just give you small glimpses into it. For example, the nasolabial fold, it is used to define the type of the canine. The canine position, shape, size, and inclination has to be in harmony with the nasolabial fold of the patient, and that's what makes a patient beautiful. But not just beautiful, that also makes the mandible function the right way, the way it should. For example, another example, the base of the nose, the columella, defines the shape of the lateral incisor. Sorry, the shape of the central incisor. Now, this is stunning. When I said, oh my God. So we are supposed to look at the face. She says, yes. And she has got a huge set of rules for this. They said to make life easy, she created the Smylist software, which has incorporated all these rules, takes these fundamental concepts and gives you the shape of the teeth, which you can easily play around with digitally and create a beautiful digital smile, which is replicated into the patient's mouth. Okay, major paradigm shift. Something that has never been documented or never been suggested in dentistry. We now have a published paper, 2 published papers on this concept. How many of you, at this point of time when I do a live thing, I usually want a response from people. I wouldn't mind getting a response from you people right now, if possible. Asking a question. Are all faces symmetrical? What do you think? I don't mind a few responses coming from the panelists. It is more fun if I have some response. I know that I'm not just talking to my computer.
No, no.
It's not
All the faces can't be symmetrical.
Can't be symmetrical. Okay, great. Would you venture to take a
Can be.
guess? Any one of you would venture to take a guess as to what percentage of people don't have symmetrical faces? Very rough. Take a guess.
Exact data we don't know.
Take a guess.
Almost might be about 78% to 90%.
Okay, that's one answer. Anybody else venturing to take a guess at this? That how many faces are not symmetrical?
There is always a little bit of asymmetry. So I would go about 95% people are having asymmetry.
Okay, now little bit or gross?
Little
Okay,
bit.
let me ask another question. If faces are not symmetrical, every aesthetic dentist teaches us to make a smile with a vertical straight midline. Am I right?
Yeah.
So we do our entire dentistry on the supposition that faces are symmetrical, and that's why we make the teeth absolutely symmetrical on both the sides with the vertical midline.
True.
Now let's see something startling. Are all midlines straight?
No.
Next question.
No.
Dentistry, nowhere in dentistry other than Smylist and Maria have said anything different. Yes, everyone says, from Ron Goldstein to Jeff Golub-Evans to any guru of aesthetic dentistry, they always make a straight vertical midline. But are all midlines straight? No, they are not. Now comes the very interesting part. So if all midlines are not straight, how do we know what is the number? So what has been done is we have done two studies on midlines. The first study was done among an Indian population, and then this study was expanded to three ethnic groups: the Caucasian ethnic group, white Americans, the African ethnic group, and an Oriental ethnic group. And of course, we had the Indian study. Now, what we found was quite stunning. They will all say, yes, vertical midlines are drawn straight, and we would say, no, not true. Let's look at this face. Let us look at this face. Now, we can do some computer playing with it and split this picture into half and take it on the other side. I can make a carbon copy of the left half of the face. I can rotate it and put it there. Now, does he look different? Definitely looking different, right? Now let's take the left half of his face. Make a copy of the left half of his face. Mirror it, turn it around. We got what, three different people? Quite
Amazing.
interesting, right?
Amazing.
I had the first time when I saw this, I literally fell off the chair. Said, damn it, I've been a dentist for 32 years. I am the past president of the Indian Academy of Aesthetic Cosmetic Dentistry. I've attended aesthetic conferences around the world. It never struck me. Faces are not symmetrical. You cannot drop a straight vertical midline sectioning the face into half and do anything. So our fundamental basis on which we do the entire smile has got a flaw.
So am I nearby to say 95%?
You are bang on target. Bang on target. That's what the two extensive studies, they are both published in journals. I can send it across to you, says. So what Smylist does, it makes midlines on the basis of fixed points on the face. It draws horizontal lines to help it. Only 5% have got the straight midline. So you were bang on target at 95%. 100% on target.
এই লাইটটা জ্বালা দাও তো।
Okay. Only 5% people have straight midlines. So what happens to the balance 95%? Now here comes the twist in the tail. If the midline is not straight, then what is it? It will be sloped. So you have a sloped midline. So there are a large number of people who have got a left sloped midline and a large number of people who have got what?
Right.
A curved midline. Maria herself has got a curved midline. Her face, skeletal face is like that. Nobody ever in 120 years of dentistry came up with the thought that midlines can be sloped or curved. Everyone thought, learned and practiced midlines are straight. No, 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 no. But now, so what's big deal about it? How critical is it that the midline is not straight? Now, because the midline is not straight, maybe you can, I hope you can see me on the camera. When we assume the midline is straight, the maxillary occlusal plane, which is created by us all the time and done by me for 30 years in rehabilitative dentistry in my practice with my other dentists, has been make it perpendicular to the dropped vertical midline. That's how my occlusal plane was always. Little realizing till Maria came along that if this vertical is sloped, this occlusal plane cannot be like this. Because this vertical is sloped, the occlusal plane becomes like this. Or if it is sloped here, it becomes like this. Or if it is curved, at the point of the curvature, it should be perpendicular. Wow. Now I said, okay, if I don't do it that way, what happens? That's when the function comes in. If you don't do it that way, your mandible cannot be balanced in its position because the maxillary occlusal plane is not in harmony with the skeletal system. And when it is not in harmony with the skeletal system, the mandible gets imbalanced and it starts creating problems in the entire body. So the first paradigm shift in our thinking in totality is midlines are not straight. The maxillary occlusal plane has to be in harmony with the midline, and these midlines are not straight. They may be sloped to the left.
So can I interfere? Can I, excuse me, so can I interfere?
Yes, please.
Yes, sir. So the midline, so in your case, you said that the midline is not, 95% cases is not straight,
Yes.
but this also depends upon the shape of the face, that is square face, ovoid or triangular face.
Yes.
And this face is like something triangular or it's a long face.
Yes. It depends on the
So I
fixed.
think it's related with the shape of the face.
It depends not just on the shape of the face, but rather on the fixed points of the skeletal system of the face. We have these fixed points, which are this point, if you can see this point, intra-alar line, those horizontal lines. I'm sorry, but it's not possible for me to take you through the entire thing because it takes us 2 hours in the workshop just to teach people how to plot the midline and how to confirm, how to ascertain if the midline is straight or it is left slope or it is right slope or it is left curve or it is right curve. There are a complex set of rules. It requires exercise. It's not too difficult, but it takes time, which is out of the scope of my presentation of the entire concept today. If you want, we'll do a special workshop for you people. We can do a full day workshop and teach you all these things on the net. Maybe when life becomes normal, I'll come down to Bangladesh and teach you people. But for now, please accept that there are certain fixed skeletal points which we have got. We plot those points. We plot horizontal lines. Let me go back and show you a little bit. Let me go back and show you.
Okay,
Since
thank
you
you.
did ask. Yeah. Here. Sorry. Yeah. Here. Do you see these horizontal lines? Okay. If you see my cursor, I'm sure you can see my cursor. These are 2 points. We make a horizontal line. This is 1 point. This is 1 point. The tip of the nose is 1 point. These are other points. We make the interalar line. And then we try to plot the vertical. And then when we plot the midline, what we get is the straight, slope, or curve, as you see in Maria's case over here. So when these horizontal lines are converging to one side, it means that the midline is curved. All horizontal lines are not straight, just like this previous one. Here, all the horizontal lines are straight because we have given a perfect explanation of a perfect symmetrical face. This is only 5% of the time. The other time, the faces are like this, what you see here. And these horizontal lines are converging. When they are converging like this, the midline becomes curved. So I know it is a little difficult to digest at this point of time. I cannot, if I would have 1 full hour, it would take me 1 hour at least to show you how to plot these midlines. We have never really done it on the net. We always done on a live workshop where we get people to take each other's photographs and draw it and do about 10 faces. And then they realize, wow, out of the 10 faces, not even one was straight. You learn how to plot those midlines. So these midlines define the maxillary occlusal.
Sir.
Yeah.
I'm Dr. Sarwar.
Yeah.
Is there any different can we find about the square face and ovoid face? The midline structure should be like this. In case of the total curvature of the midline structure,
Yes. No.
it should be the similar to the ovoid face or
No. That was not. We did the study and we did not find any correlation between the midline and the face shape. You will get curved midlines on a square face. You can get curved midlines on an ovoid face. You can get curved midlines on a rectangular face. You could get a
in
straight
any that means any source of face can take each and every source of midline.
Yes, absolutely right. There are
It's a
5.
very difficult thing.
There are 5 kind of midlines. One is the straight midline. One is the left slope. One is the right slope. One is the right curve. One is the left curve.
All these are the relevant to the each and every facial size.
Yes.
Mane,
yes.
Okay.
Yes.
Okay, carry on, sir.
Yes, and that is what defines the maxillary occlusal plane. You people are going to get completely flabbergasted because I'm going to change, by the end of this presentation, we are going to change the entire concept of dentistry upside down. Now, this is a Smylist aesthetic design software. That software automatically, you just mark the points and it plots the horizontal lines, creates a vertical line for you and tells you how the occlusal plane should be. All that is done in a matter of 10 minutes. That software has got everything designed and built into it. All the set of tools are there with it, and it makes this virtual smile. And we can show it to a patient also. We regularly show it to our patients. Individual tooth characterization is done, as I was talking earlier. And what we have done is we have grouped together all the parameters into what we call as 8 Smylist parameters. We apply these 8 parameters to the face and the teeth. The facial geometry is taken, applied to the teeth, and we are helped to a great level by the software. The picture that you see here, there is no dentistry done on the patient. It's only virtual dentistry. What you're seeing here is virtual dentistry. It's not that you have to create each of those teeth here. All this is done automatically by the software in less than 10 minutes. And it creates instant before and after pictures. But please, this is the tip of the iceberg. This is only the aesthetic component. We are going to come up with something dramatically different very shortly. So this aesthetic design software has got 60,000 possible combinations of smiles. You take the right appropriate combination for a patient. Now, what is the aesthetic software doing? It is only designing. Now, people get very thrown off. But what is happening to the mandibular teeth? We are not worried about it. The mandibular teeth only have to follow the maxillary. We just have to define the shape, size, and plane of the maxillary teeth. Smylist, Maria has tried to make Smylist as simple as possible, but you have to accept the totally different concepts. So the concepts give you a maxillary occlusal plane, give you maxillary teeth of the right shape, size, etc. in 60,000 combinations, possible potential combinations. You pick one combination and you make the smile for that particular patient. And once that maxillary teeth are done, the mandibular teeth just follow that. That's all. Okay, now let me show you the functionality. I'm sorry, we have to put some masks over there to cover the eyes because we don't have full permission from the patients to show. So this is mandatory in Europe. Now you see this lady over here. Now you're talking of face shapes, right? This is a classical square face, square or rectangular face. Any guesses how old is this lady? I like some interaction, please.
45 to 50.
45 years.
45 years.
Yes.
Anybody else?
Hopefully,
60.
60?
no,
No, 60, 60. 60.
Yeah,
60.
no.
40 years, sir.
40. Well, she is, believe it or not, she is less than 40.
Oh.
But she looks old.
Really?
She looks old.
But she looks,
Yeah,
she
she
looks
looks a
old.
bit, yeah, as our experience shows that with the teeth conditions, smiling and wrinkles and
Yeah.
teeth, I mean, so
Okay.
yeah, it's exceptional, I think.
Let me introduce a new word. This is a Smylist word. We call it natho aging. GNATHO aging. We call it natho aging. What Maria discovered during her practice, and this was one of the, I'm putting a lot of things in the jigsaw puzzle of Smylist. This is just one of those blocks. That a person ages or looks much older than the actual age because of something known as natho aging. Natho aging is something that happens because the mandible is not balanced and is not in its right position. By not being balanced and not being in its right position, faces become asymmetrical, certain muscles get hypertrophied, face shape changes, and a person looks much older than the person is supposed to look. The skin tonicity goes bad. Because the skin tonicity goes bad, there is not enough blood supply which takes place to the skin, and all these causes a person to look much older than the actual age. And how do you correct this? You correct this by making the maxillary teeth in harmony with the skeletal system and making the mandibular teeth follow the maxilla. And in a matter of few weeks and ultimately in a matter of 6 months, the person goes back to what they should really look like.
Professor Ajay, one minute, just I'm curious. I guess the patient with, I mean, some sort of bruxism, as it is showing the posterior teeth the much more, I mean,
Yes, yes,
treated.
yes. You're right. You're right.
What do you think? So we have to correct that one also, I think.
Yes. Patient has a parafunctional habit. Okay, since you brought it up, and I'm not really going to talk about much about the parafunctional habit later on, let me talk about it now. There are two major parafunctional habits which are of issue to us. These two are in the world of perio. We call it, we always refer to it. There's a 2-mark question which comes for undergraduate students, bruxism. Correct? And the second parafunctional habit is clenching. Now, why do we get bruxism? Our books, literature gives what I call as a number of things without any evidence. One of the things which is a what I call as use it everywhere. Wherever you don't find any reason, just use this. Stress.
Yeah.
You get a heart
Number
attack
one.
because you got stress.
Mm.
Your hair has become white because you have got stress. Your teeth, you have got bruxism because you have got stress. You have got stomach ache because you got stress. You got acidity because you got stress. But what is this stress all about? Nobody defines it. Nobody tells us. You know what? From the time I was doing MDS and reading bruxism, I never found the real cause of bruxism. Why does a person brux? It is fine to give
As
some
we,
exam answer.
as you know, that patient relief either her stress during sleeping, uh, that is the main cause of bruxism.
What is the main cause? Sorry, come again.
Relief, because in the literature says that patient relieves his or her stress in
How?
sleeping by bruxism,
The logic.
by
Tell me,
masticating.
tell me what is the logic in this. I know I've read this in the literature. There are at least 30 references. But where is the logic?
Mm.
My logical mind.
Is still not defined as a whole.
Exactly. Believe it or not,
Okay.
Smylist was the first theory which gave me conclusive evidence of why a person bruxes.
Mm.
I cannot again, that would take me a half a day lecture, that's part of our workshop. But we can prove it to you why a patient bruxes. And the proof is so simple. Correct that what we are talking about, and the bruxism vanishes. Person stops bruxing. We do not give mouth guards. A mouth guard is just something to block the negative effect of the bruxing. It does not take care of the bruxing. But we can stop patients from bruxing. And I've been doing that for the last 1 year, 2 years, very happily. Okay, now let's see what happened with this patient. You see a change? See how the face is changing? This is just
Yes.
weeks. This is just 2 weeks. You see her face shape changing?
Yes.
Notice something. What is the
Yes,
most,
amazing. Amazing.
if this is amazing,
Amazing.
I'm going to show you a little later, you will jump out of your chairs. What is the most drastic difference between the two faces? One muscle, I'm giving you a clue. On the pre-shot, what is the muscle which is really hypertrophied? On the face, the masseter. Can you see a right masseter and also the left masseter? Within 2 weeks, that hypertrophy is going down. It is not just the shape of the teeth or a good teeth. It is the face which is changing. We are going to show you a little bit more later on. Sorry. You want to see what happened after 1.5 months?
Please.
Just 6 weeks.
Unbelievable.
Yes, sir. It's miracle change.
You wouldn't believe that it's the same patient, right?
Yeah.
Unbelievable.
Unbelievable. Really.
Okay, what is the dentistry done? The dentistry done is something that all of you can do. Each one of you can do this dentistry. What has been the dentistry done? It's even without seeing all intraoral photos, etc., etc. What you can see clearly is that she has got veneers on her anterior teeth. She's got onlays and crowns on the posterior teeth. Okay? But the key is the occlusal plane. If the occlusal plane is in harmony with the skeletal system and the vertical dimension is perfect, we call it the Smylist bite. The Smylist bite is obtained by deprogramming the mandible, and we do the deprogramming in 15 minutes. 5 minutes, not 15 weeks or 6 months. as done by the entire dental world. We actually deprogram in 15 minutes. Now, what has happened really with this patient? He had a quadratic face, and that face is becoming oval. A quadratic face, not because the skeletal system was quadratic, because the muscles were hypertrophic. And the muscles come into balance, and the patient starts looking young. That's just one of the things. Let's see another. 2 weeks. Just 2 weeks. That's the difference that was created in 2 weeks by Maria. Next paradigm shift. No more averageness. Now, this is a thought which was given by Maria, that you cannot use averages. You
So
cannot.
can you see, hello, can you see, sir, can you show us the pre and post, the side-by-side face of this patient?
I'll have to go back because this is the way the slides are.
Okay, so you just increase the height or crucial height, is it?
This patient, you mean?
What did you do? You increase the height, vertical height?
It is not increase of the height. It is not just increase of the height. If you will be patient for the next 10 minutes, we are going to come to the Smylist bite. That is part of this presentation. So I will answer your question over there. Okay, is that fine?
Okay.
That's very much part of this question. I will answer your question over there. So the second paradigm shift is that we are generally taught that make the centrals of this particular size. This is the average size of the central incisor. The law of averages does not apply in dentistry, is what Maria says. Each individual person, based on the face, should have a certain amount, certain size of teeth, certain shape of teeth, and a certain vertical dimension. That vertical dimension cannot be preset as it should be between 8 to 9 millimeters or 8 to 12 millimeters. No, 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 no. It has to be individually done for each patient based on certain objective rules. And this is set by taking the Smylist bite in what we call as 3 planes. The 3 planes, now you are, somebody was saying vertical. It is not just vertical. It is vertical. You see my face? It is anterior posterior. It is lateral. So in 3 planes, we have to relate the mandible to the maxilla based on certain rules, which is called the Smylist deprogramming technique. In our workshop, we make every participant do the deprogramming, and they successfully achieve it and learn it in about 3 hours of time. That's all it takes. That's all it takes. It's not complicated to do deprogramming. Like a lot of advanced dental schools make it. That, oh, this is the most expensive program. They have to come there for 4 weeks to learn how to do deprogramming. 2 hours, 15 minutes, deprogram. So the second paradigm shift is no more averages. The law of averages does not allow customized smiles. You cannot make average, use an average and put that average for every person. No, doesn't work that way. Now let's look at a little bit of function. This function is related to the mandible and the movement of the condyle in the TM in the glenoid fossa. This mandibular movement has been studied by many people. A lot of complex methods and techniques have been created for assessing the mandibular movement, etc. Believe me, we don't need to do anything so complex, but we achieve highly complex results with an understanding of what the mandible is supposed to do. You know, as dentists, when I first did the workshop with Maria, I felt a little awkward. As a dentist, I was supposed to know everything about facial muscles. I'm showing you a photograph here with so many muscles. I myself could not You know what we do in the workshop? Because we have time, we just put all these lines and we don't put the names of the muscles. So we ask the participants to put up the names of the muscles. And I can very honestly tell you, the first time I did the program, I myself could not name all the muscles. I learned at some point of time in first BDS, but never used it in dental practice. And Maria says, very critical. These muscles are the make and break of everything. If you don't know the facial musculature, you are not going to be able to get the correct Smylist bite. You don't get the correct Smylist bite, you don't get the proper function. So you need to know about all these muscles to thoroughly understand what happens. See this patient, how the muscles have created a big problem over here. The muscles have created a problem because of what? Because the mandible is not in the right place. Why is the mandible not in the right place? The mandible is not in the right place because the maxillary teeth are not in harmony or synchrony with the skeletal system. Now, Smylist shows a dramatic but logical connection between the mandible and the rest of the body. I'm going to ask all of you to do small, very, very small, simplistic exercises. I've never tried to do this on the net before, never done it on a webinar. I'm trying it for the first time with all of you. So cooperate, maybe we'll work something out. There is something which Maria created called the negative cascade effect. How many patients have got lower backache? A large number of them. A large number of patients have got lower backache. Now, they are treated by orthopedics, they are treated by chiropractors, they are treated by Ayurvedic massage, they are treated by other massage therapy, they are treated by yoga. Yoga definitely helps, massage therapy definitely helps, physiotherapy definitely helps, because what they do is they treat the symptom. Now, why are you getting that backache? You're getting the backache because the muscle, some muscles of the back are in spasm. That is the cause of the backache. And the symptom is the spasm of the muscle. So what is being treated? The spasm of the muscle. But what caused the spasm of the muscle? Big question. If it is in too much spasm, orthopedic will give an antispasmodic, will give a muscle relaxant along with it. Definitely helps. The physiotherapist definitely helps. Yoga definitely helps. Massage therapy definitely helps. But it doesn't remove the original cause of why the spasm keeps on happening constantly. The spasm keeps on happening constantly because you're not going to believe me now, but I will prove it to you by the end of my presentation. The mandible is imbalanced. The entire musculoskeletal system is like a spider's web, connected from top to bottom. And in a spider's web, if you were to tug at any one corner of the web, that whole web gets distorted. And to compensate, muscles try to go into spasm. I'm going to prove it to you very shortly, at least to the panelists or whoever is listening to the live feed. If you can try it out, because there's only a one-way communication between you, me and you cannot respond back, but my panelists can definitely respond back to me. So we will prove it to you that these backaches, muscle spasm is happening because the muscle is in spasm. The muscle is in spasm because the mandible is imbalanced. Migraines. How many of you, a few of you might have heard of the NTI, nociceptor trigeminal inhibition. Jim Boyd is a dentist from America who created the NTI. I would like all of you to do a very small experiment now. I'm just looking at my computer. I'm assuming you're seeing my face right now. What I want you to do is, if you can grab a pencil or a pen or anything like that, a piece of anything, a pencil or a pen, and keep it handy. Now what I want you to do, at least the panelists and also all the people who are listening to me wherever you are, you cannot respond back to me, panelists can respond, but just do this. I'm taking out my specs for a moment to give you a more easily explainable thing. Put your hand on the side of the head, temporal. We are what? Palpating the temporalis right now. We are palpating the temporalis right now. Now, clench your teeth the way I'm going to do. When I do this clenching, I can feel my temporalis contracting. I would seriously request, I'm not looking at your cameras because I'm looking at my computer screen. Seriously request all of you to try to do this. And you'll see that when you clench, you are contracting your temporalis. Does that happen? Some response?
Yeah.
Happening,
Yes,
right?
we found. Yes.
Happening? With others also happening?
Yes.
Please try. Okay.
Yes. Yes.
Now, we spoke about bruxism earlier, right? Let's talk
Yeah.
about clenching. Nocturnal clenching. Now, I'll give you the reason for the clenching a little later. But because some patients consistently, constantly are doing this nocturnal clenching. When they sleep in the night, when they get up in the morning, you know what happens? Every 3 to 4 weeks, one of these temporalis muscles, because of constant contracting, goes into a spasm.
Wow.
It goes into a spasm. They wake up with what is called as a migraine headache. Unilateral one-sided migraine headache. The Association of Neurophysicians of America have accepted this explanation, and it is published in the literature that 90% of migraine headaches are caused due to a spasm of the temporalis on one side, which is in turn caused due to consistent nocturnal clenching.
Wow.
Amazing, right?
Yeah.
Now, so Jim Boyd was a patient himself. He used to get a migraine attack every 2 weeks. And his migraine attack would not go away for 3-4 days. He literally had to give up his practice. And there was a Dr. Wesley Shanklin who helped him out and came up with a thought. I came up with an idea and said, you know what? This temporalis cannot fire without posterior teeth contact. So what I want you to do now is I'm going to just be away for 10 seconds because I'm going to get a pencil or a pen which is lying handy for me. Here it is. Here I'm back. I just got a pen with me. Now see what I'm doing now. I'm holding the pen between my upper and central incisors. Please do it yourself. Now there is no way your temporalis can fire. Try to do it. Impossible. Completely impossible. Try it. You will not be able to fire your temporalis. Okay?
Yeah.
You cannot fire your temporalis anymore. So, Jim Boyd came up with a brilliant idea. He said, let's make a small plastic appliance which we stick into the upper central incisors in the night, which does not allow any posterior contact. Now when the patient clenches, they only clench on the device. No migraine. 100% sure shot method of treating migraine.
Wow.
Any of you listeners out there want to treat a migraine patient who is sick and tired of the pain, make an NTI device. How to make it? Send me email. I'll guide you out, help you out. We have done number of patients. Migraine gone, 100% gone. But I was very thrilled when I used to do this. But you don't wear the device, you clench, migraine back. Because we did not know the reason. And here comes Maria and tells me the reason for the clenching. Balance the mandible, the patient won't clench anymore.
Yeah,
What?
Prof. Yeah, I am afraid that if any patient continuously use such a,
Device.
appliance, it can change his either her occlusal or vertical height. What do you think?
No, because they only
No,
do that on the night. It's
continuously posterior teeth are not in contact, and
only in
patient
the
is
night.
using this for the long time. Then
Only in the night. Only in the night. Only while sleeping.
oh,
Only while sleeping. Only while sleeping.
okay,
But
okay.
the answer, that was only blocking the symptom. The cause was not known by Jim Boyd or Wesley Shanklin. Maria gave me the cause. Unbalanced mandible. Balance your mandible, patient will not clench. Patient will not brux. Migraine gone. No device, no appliance. Phenomenal. So here we were as dentists now treating backaches, treating shoulder aches, treating migraine. The story doesn't end over there. Knee pain. I'm sure most of you are aware of people who require unilateral knee surgery. Yes or no?
Yes.
A lot of people require unilateral knee surgery. 50 years of age, one of the knee is gone bad and requires to be replaced. Knee replacement surgery in 50, 55 plus years of age. And usually the reason given is you overloaded it, you did too much damage, you did too much exertion, etc., 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 etc. What if I send all of you an published article on how a mandible which is not balanced leads to unilateral knee damage and ultimately requires knee replacement? It can be stopped, prevented totally by balancing the mandible. I'm sure none of you are believing me right now. You're just not believing me right now, but it is true. To give you the evidence, I'll send you the published article. As simple as that. That has given the whole cascade of reactions of why an imbalanced mandible which is deviated or rotated to one side like this causes the patient to tilt the head to get comfort, causes the patient to thus raise the shoulder on one side to get comfortable, thus causes the patient to twist the other shoulder forward. You can't see that because my camera is only showing my face, which causes the hip to be twisted in one side, which causes the patient to load one leg and not load the other leg. And in 15 years of time, you get a unilateral knee damage requiring surgical replacement. Can be prevented, stopped totally with balancing the mandible. So as dentists, what can we do now? And there is no technique in this which you have to learn from scratch. All you have to do is create the correct occlusal plane, get the correct relationship of the mandible to the maxilla by getting the Smylist bite. So all that you have to learn is how to do a Smylist bite, how to record a Smylist bite. Once you have recorded the Smylist bite, Maria and I don't care how you rehabilitate the teeth. Composites, ceramics, metal-free ceramic, emax, zirconia, bruxil, does not matter. Make the mandibular maxillary relationship correct and knee pain gone. You are going to prevent. It's my mission in life to spread this so much that unilateral knee surgery will be forgotten. That is my 10-year mission in life now. Now you think I've gone completely crazy. Acidity. What the hell can the mandible do that can cause acidity? I can right now, when a patient walks into a new patient, I invariably can point out this is an acidity patient. And I'm correct 95% of the time. Maria is correct 100% of the time. She's far more superior than me. Now you'll start wondering, how the hell can mandible cause acidity? Would you like me to explain? I think you would want to know the explanation. So I'm going to give you this explanation now. of how the mandible can cause acidity. Okay. Have you people seen in India? It's very common, Balaji, for you when you were in Rajasthan, the Gujarati Rajasthani population, very common to have retroclined maxillary teeth, retroclined maxillary centrals and laterals,
True.
which leads to the mandible in very retruded class 2 kind of position. I don't know. I'm sure in Bangladesh also you have seen so many patients like that. Right or wrong? Hello?
Yes, yes.
Yeah,
Yes,
okay.
sir. Yes,
Okay.
sir.
When you have seen these patients, you have never really asked them whether you got acidity or not. Why would you? You never knew that it is anything to do with acidity. Now just look at this hypothesis by me, and this hypothesis is proved right whenever we see a patient. A retruded mandible causes less space for the tongue. In our textbook of perio, we have got one again 2-mark question for UG and occasional viva question for PG students. Macroglossia, correct? Macroglossia, which is indentations on the tongue on the lateral border of the tongue. And we called it, the textbooks called it big tongue, macroglossia. Not correct at all. The tongue is not big. The space is less because the mandible is retruded. It is pushed behind. Because the mandible is retruded and pushed behind, the back of the tongue inadvertently tends to touch the posterior wall of the throat. Every time the tongue does that, it's a signal which goes to the brain which tells the body food is coming when there's really no food coming. If the signal is gone to the brain that food is coming, what does the stomach do? Release acid. So these patients constantly keep on releasing acid because that signal keeps on going from them. And because that acid is constantly released, they get acidity. They get a barium meal done, they get a sonography done, they get a scopy done, everything done, no pathology found, but the patient has got acid. Because the mandible is in a retruded position. Shocking but true.
Yeah.
Shocking but true.
Really new theory.
In 120 years of dentistry, nobody thought. I'm telling you too many new things, right? Now imagine a 30-year-old dentist working on her own in Budapest, starts thinking all this, goes to her seniors who laugh at her, and she is convinced that she is right, and she creates this entire concept single-handedly.
Is it a hypothesis or the published articles?
Published articles. I will send you a few.
Okay.
And this is the beauty of this genius called Maria Gennari. That's acidity. There are many more other things. Loss of breath. You know what? Most of you here are 40 plus, except that lady who was asking me to make her the host. She looked the youngest over here. I'm 60 years old. Most of the people here are 40 plus. And what happens? You become 40 plus, you hit 50. Do you think you can run up 3 floors, 3 stories? No, no. What you do is you start taking a lift. And what do you say? Part of life. In Hindi, it is not Bangla. I'm sure there's a Bangla translation for it. Umar ho gayi. Now we have become aged. We are becoming old. And a lot of people accept it as part of life. Loss of breath. Now, you know what is the reason of the loss? You go to a physician, go to a chest physician, and everyone says loss of breath. They try to do this, do that, but I'll give you a very simple logical explanation now. I'm going to try my best to go to meeting control. Okay, for a moment, everybody, I'm stopping screen share. For a moment, I'm stopping screen share because I need to know a little bit, and I'm going to move away from my laptop now I'm going to move very much away from my laptop because I'm going to want the camera to try to capture my posture. I'm going to try. Never done it before. If I had done before, I would have put a different camera for it. But I'm going to try to let the camera capture my posture. So I'm going to be away from the camera. So my voice may become faint. But I'll try to talk loudly just to give you a proof of the pudding. And I want all of you to try it out what I am doing. And you'll be shocked. You'll be totally shocked. Okay, what I'm going to do is I'm going to stand up now. I'm going to stand up now. Can you people hear me? I'm shouting loudly.
Yes,
Yes, yes.
yes, sir.
Okay, great. Can you see I'm standing?
Yes.
Okay.
Yes.
I'm standing straight and pretty good. I'm standing straight and nice. Let me just turn my camera. Okay, I'm standing straight and pretty good. See me from the side view. I'm pretty good because I've got a decent posture. But everybody doesn't have this posture. There are a lot of people who have got this posture. Now I'm going to mimic a bad posture. Why that bad posture happens, I'll tell you later. But there are too many people who have got this bad posture, and you will be able to see this from tomorrow morning. You'll start looking at people and see their posture and say, this is the problem. But you know what the posture? Okay, I've done the posture. I don't know whether on the straight view it is very visible, but this is how it is on the side view.
Bending.
You see my posture? My head has come forward, my shoulders are forward, and my back is slouched. There are a lot of people who stand like this. You'll find too many people like this. Now, what I want all of you to do is stand up, bring your shoulder forward, stand up, bring your shoulder forward, and I challenge if anybody can try to take a deep breath. Do it. Please, 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 please do it. Humor me. Stand up, bring your shoulders forward, and try to take a deep breath. But you have to stand for that. You can't do it sitting. Please, please stand up, bring your shoulders forward, and try to take a deep breath. You don't need to be on camera. Just try it and come back and tell me, was it possible? You can't take a deep breath if your shoulders are forward because your rib cage is constricted. People are not using their lungs even to 50% of their capacity. When you don't use your lungs to 50% of your capacity, you get shortness of breath. You get tired very easily. You cannot climb stairs. Now these people, the physician gives some medicine here, there, and then tells them to do yoga. When they do yoga, they get a transient relief because the yoga improves their posture, but doesn't remove the cause of the bad posture. So the bad posture constantly keeps on coming back and doesn't get completely treated. The bad posture, this posture, is caused due to a deviated, what we call as an over-rotated mandible. I cannot give you details of that, not possible. But an over-rotated mandible, the posture gets corrected like this. I'm going to share screen again. I'm going to actually show you a patient for whom, which was done by a student, not by Maria. If you'll say it was done by Maria, oh, what big deal, Maria knows everything. Maria's student did it. And Maria was not present. He did the program and the student did it. From the mandible to the posture, body muscles, organ functioning, bones, and the energy system. You see on the left side? Now you'll start wondering, tinnitus, have I gone crazy? Yes. Tinnitus is caused due to a overreactive trigeminal ganglion, which starts becoming hyperreactive because of constant clenching. And the trigeminal ganglion is located right next to the nerve which is going into the middle ear, causing tinnitus, migraine, cervical spondylitis, neck ache, restricted hand movement, backache, acidity, reduced vital capacity. unilateral knee pain, early onset aging. All this is caused by the mandible. All you do is take a Smylist bite, correct the mandible position, rehabilitate the maxillary teeth, and all this gone. What have we become from dentists? We're treating the entire body. Let us see this patient. I hope the video works. Yes, this video is working. See this patient. How does this patient get up? This patient finds it so difficult to walk. Patient is 54 years old and actually stopped working. You see how the patient walks?
Cannot see the video.
You cannot see the video?
No.
Nobody can see the video?
No,
I can see. I can see.
I can see.
I can see.
I
I
can
can
see.
see. Yeah.
Well, the person who can't see the video is possibly because of a graphic resolution. I'm sorry, very, very sorry. I really wouldn't know how to sort it because most of the people are seeing it. I hope the live feed people are seeing it. I cannot get a response. I'm going to play it again. See how the patient
Yes,
gets up. Patient cannot get up straight, needs to put the hand on one side and see how he walks.
yes, sir, you can see.
See how the patient walks. I'm sorry for the person who cannot see the video. Okay? Now, this patient, why is the patient like this? Because of the mandible which is deviated, rotated to one side. So what did this dentist do? This dentist had done the Smylist program. So the dentist did one simple thing, did 15 minutes of deprogramming. Now the patient is wearing the Smylist bite in the mouth. The mandible is in the right place and told the patient to wait for half an hour. 30 minutes with the mandible in the right place and see the difference. See the difference? I'll play it again. See how he gets up? Straight up. Walks comfortably. See the back. See the posture. See here. See the posture. See the head position changing. 15 minutes. Amazing? That's what a Smylist bite does. These are various body postures. I could dwell on the postures for a long time. The body compensates to bring balance from head to toe. The mandible, which is right at the top, is tugging the spider's web here or there if it is not balanced. And when it tugs the spider's web here or there, it leads to these bad postures. And these bad postures cause problems. I'm not going to go through all the postures. Too long, too complex. But these are the postures which cause problems. Now, most important, what I'm trying to build up to is the maxillary teeth have to be first corrected in terms of shape, size, occlusal plane. The mandibular teeth have to be just brought in accordance with the maxillary teeth. If that is not in accordance with the midline, with the skeletal system, with the Smylist bite, nothing is going to work. All the correction in the occlusion will not work. And that is why Maria says occlusion is an illusion. The occlusion is not the key. The occlusion is created by the correct mandibular position. We call it routine. If the mandible is not balanced, we call it the FOP in Smylist language. It's called the forced occlusal position, which our mandible is being forced to go into that place where it does not want to go, where its muscles are not balanced. And it causes all these set of problems. The new role of the maxillary teeth to work as a fence or a stop, to bring the mandible into the right place and have it in harmony, to not let all these so many problems happen, is the new paradigm shift. This is called as a rotated mandible, where the mandible is moved to one side instead of being in the right place, due to which muscles on one side of the mandible get stretched, other side get contracted, they're not in balance, remain in spasm constantly, and create all these problems. So this is how we do the deprogram. We record the maxillary mandibular relationship after the deprogramming in what is called as a Smylist bite. This is a shot of a Smylist bite being taken. This is a Smylist bite being taken. This is the new position of the mandible to the maxilla, and both are built up. Instant deprogramming with the Smylist bite. I don't unfortunately have a pre-op, but believe me, this patient is the father of a dentist who was doing a Smylist workshop. After the first day of the workshop, he asked me, "Can I bring my father?" I said, "What is his problem?" "He can hardly walk." They had a duplex bungalow. He says, "I sold that bungalow to get a single-story house because my father cannot climb stairs anymore." I said, "How old is your father?" 58, 1 year younger than me at that point of time. I said, "He cannot climb stairs?" "No. He has been operated for spine surgery, no relief. Has been told to be operated a second time." I said, "Please bring him." The patient came to the workshop. It was too complex a patient for me to comprehend. Maria did his deprogramming, and a person who couldn't walk and not climbed the staircase for so many years now, for nearly 5 years, he is walking up and down the stairs. Half an hour after deprogramming. I'm talking to the patient's son, who's a dentist. And everyone was shocked that this patient was walking like this. I'm not going to dwell too much on this now. So we do things with direct composite build-ups, indirect crowns, ortho, anything that is needed to get the maxilla and mandible into right harmony. And we have got the tools for it. 4 or 5 sittings, you do full mouth rehabs. No face bows, no articulators, because it's all digital. So I would like to just show you a couple of, see this posture. See this patient? See how the posture got corrected? In just 15 minutes. Of course, the photographs are on 2 separate days, because the first day we just analyzed the patient, called the patient for a Smylist bite, the next after a week, and gave the bite, and in 15 minutes, patient has no clue, but the posture corrects itself. Bring the mandible to the right place and the posture corrects itself. See here, posture corrects itself. Let me end it with a case of nathoaging. Patient pretty good looking, not so bad, not so old, but still she said, "I become older than my age. I want to look younger. I want to look prettier." Teeth were not so bad, but the Smylist concept saw that her teeth, her mandible is deviated. Can you see the 2 nasolabial folds? Very different. This is vertical. This has become horizontal because the mandible is deviated to this side, rotated to one side. Corrected the mandibular rotation, did a Smylist bite. She had a curve. This is an analysis done on the Smylist software, curved midline. 6 weeks later, see how the face shape changes. She was thrilled. She changed her hairstyle. She looks young. What is the most dramatic difference in this patient? The most dramatic difference in this patient is the zygomaticus muscle. And because of the zygomaticus muscle, her eyes change. The zygomaticus is just below the eyes. Because of that, her eyes change. Her skin tonicity changes. She has no makeup on that last photograph. The skin tonicity changes, gets more blood supply, becomes younger looking. Her mentalis, just note the mentalis. The mentalis in the first picture is hypertrophy. The mentalis hypertrophy is almost gone. And see her nasolabial fold. The nasolabial folds are correcting itself. Her face, which was becoming more and more rectangular, has gone back to its original oval shape. Natho aging. Reversed with Smylist correction. Sorry. Yeah, that's about the last slide. Yeah, that's the last slide. So I will stop the share now. Come back to the original. And that's about is a summary of the whole Smylist concept, creation of Dr. Maria Chennai. Just wanted to show you what is possible with Smylist. We want to learn more about Smylist. I have got my email ID. Please pass on my email ID to everybody. Ajay@bitein.com. BITEIN.com. BITEIN.com. Please pass on that email to anybody and everybody. Whoever wants, I'm there to help you out, answer all queries. And my desire that this stupid pandemic is going to end sooner or later. 2021 will bring us good things. Would love to come to Bangladesh. Would love to bring Maria to Bangladesh and get Smylist into Bangladesh and maybe to Saudi also.
Welcome. waiting for your new concept. Yeah, Professor Ajay, thanks. The last slide that you showed the correction of the smile. But
Yes.
how could you find out which muscle really responsible to do it?
We have got we do
As because you just put the specific is zygomaticus muscle, but how
Yes.
can you find it?
By looking at the face. We teach all our participants how to see the face and how to identify muscles. As
With an
dentists, we
experience.
just don't do it. As dentists, we just don't do it because we never thought it's important. We forgot all about it. We learned it in first year in anatomy. We answered all the exams. We passed the exams, and then we promptly forgot it. We just revisit it. Takes half a day. We have a half a day session how to identify muscles, which are the indicators of muscles which are imbalanced, which are hypertrophic. It's there, but it's complex. I cannot possibly tell you which and how, but half a day session. We do a 4-day workshop. I had crammed the 6-day workshop into a 4-day workshop, which makes you pretty competent with Smylist. And then we got an advanced workshop of 3 days, which is done only for people who have already done Smylist and are practicing Smylist concepts in their clinical work.
Thanks.
Hello, finished, sir.
I'm done. I'm here for as many questions you want to ask.
Thank you, sir. Thank you, sir, for your excellent and nice and longest time-demanding presentation. As because of aesthetics has become increasingly important in the practice of modern dentistry. The goal of this makeover is to develop a peaceful, stable masticatory system where the teeth, tissue, muscles, skeletal structure, all functions are in harmony. You are rightly mentioned. So thank you very much, sir, for your nice and excellent presentation and time-demanding presentation in this time. So I would like to go in our panel of experts to say something regarding this seminar and any question to the speaker. First of all, I would like to request Professor Dr. Humayun, Professor and Head Department of Periodontology and Oral Implantology, Kathmandu University School of Medical Science. Professor Manoj,
Yes,
do
thank
you
you,
hear
sir.
me? Sir, please.
Thank you, Dr. Ajay, for very nice presentation. It's indeed highly informative for me as well, because I was not much aware of this concept. I was just thinking that it is something to do with the smile design or digital design. But you I have incorporated all the aspects, the physiology, the muscle movement, muscle adaptations, and different aspects. It's a complete package, and it's highly interesting, and we could learn a bit about it. I think we need to go more in-depth knowledge about it.
Sure.
I'm highly interested. I'm impressed with this.
Oh, thank you so
Not
much.
only in Bangladesh, I think we should invite you to Nepal as well.
I'll get Maria to Delhi, we'll fly down to Dhaka, and then we'll fly down to Kathmandu. I love coming to Nepal.
Yeah, you will be. I would be very happy to welcome you here, and Miss Maria, and I hope many of the Nepalese dentists also will be interested. It's indeed amazing presentations with the amazing improvement on the facial profile and the aesthetics. Quite surprising results we have witnessed it today. We would love to learn this technique. Thank you, Ajay.
Most welcome. Most welcome.
Thank you, Maharaj, Humayun, Professor. Thank you for your comment. Now, already we have been seen that so many professors join with us, Professor Syed Morshed Maula sir, Professor Asad Nisa sir, Dr. Asif Iqbal, Dr. Ahmedul Kabir Milan, Muhammad Tahir. Thank you for joining with us. Now, I would like to request to say something to Professor Dr. Balaji Manohar, Principal Professor and Head, Department and Periodontology, Bhubaneswar.
Thank you, Dr. Talukdar. Dr. Ajay, thank you very much for an eye-opening presentation. I'm sure that everybody must have realized by just correcting the occlusion or the relation of the mandible to maxilla, so many problems are getting solved. Not only the facial, but even the other parts of the body which are, I think, connected. At present, I do not have any doubts because I think I will need to learn about it so that the doubts will come. So, question-wise, I think the mind has become more inquisitive now to learn more about this, and probably I would definitely, if time permits, come and join when Maria comes to India. Probably learn this and probably help in doing patient care much more better.
Sure.
Thank you, Dr. Ajay. Thank you.
Sure. If you permit me, I would just like to tell something small to all the participants here, that we were supposed to do a program in Budapest this year in March. It got cancelled because of the pandemic. But the most I've traveled, and today I managed to reach a landmark last year of having traveled to 50 different countries.
Wow.
And my most brilliant experience has been Hungary, to the village of Tihany, which is about 200 kilometers away from Budapest, where we do half the workshop. It was voted as the most beautiful village in the world.
Wow.
You have to go there to know what is we call Jannat.
Oh.
It is unbelievable. It is worth coming there for the program just to see Tihany. Forget learning Smylist. So next time I take a group to Budapest, I will tell all of you, whoever is interested, please do come.
Right, sure.
Thank you once again, Professor Kakar, and also Professor Balaji, for your nice and excellent presentation and comment. Now, I would like to request to say something, Professor Anirban Chatterjee, sir. Sir, do you hear me?
Yeah, I'm there.
Yes. Thank
So
you, sir.
nothing much to tell. Thank you, Ajay. I've been knowing, as he has already mentioned, for 25 years, and he has been a great speaker. He comes with always a new concept in dentistry. No, I'm telling you. So it will be a new concept actually for a dentistry to like we have a periosystemic disease like that. He is going to change from dental to systemic disease. He's going to recover all the back spasms and knee to everything. So we will come up with a new concept of MA concept, that is Maria Ajay concept. MA concept, new thing. So Smylist will become MA Smylist concept. which I'm just thinking like 2021, we might be able to hear of something new. And something new also will come up with this, Ajay. And congratulations, this was a wonderful presentation, as usual. As usual, he is a voracious speaker, and all the not only panelists, I think everybody was just seeing and listening to what he was speaking, and that too with proof. I'm so happy.
Thank you.
A good friend of mine, he's doing wonderful thing. So as Balaji told, next time when Maria is there, or we can go to Budapest and learn what exactly, and all over India we can throw this light all
Yes.
around of MA concept.
Ajay, I'm just sharing your article which has been published on the screen.
Thank you, sir. Professor Chatterjee, for your nice
Thank
and
you.
excellent presentation.
Yeah, Balaji has already given
This is
thing
good.
what has been.
This is a professor at work.
Article facial midline variation in as ethnic group.
Yeah.
Abstract.
Really good.
Nice.
Balaji. Thank you, Balaji.
Thank you. My pleasure.
Wow. Wow.
Yeah. Okay.
I think you should do some few studies with the Indian population.
Done. Already there.
No, Indian means some ethnic, in the sense from different states.
Okay, that's a good
Like
idea.
what?
Good
Yeah,
idea.
what I mean to say is, see, I am not. I'm just saying. Usually we see class 1, class 3 in Malayalis more.
Yes,
Like
yes.
they have prognatic mandibles and all those things. I feel that can be taken up. No, just on a
Great idea. No, great idea. Ethnic groups within the Indian population.
exactly. That's what I was trying to say.
Great idea.
Thank you, sir. Thank you for your nice and excellent presentation. Now I would like to request from Saudi Professor Dr. Ajay Kakar. Would you please, sir, do you hear me?
Yeah. Thank you, Dr. Morshed.
Sir,
It is
yes, please,
really
sir.
it's a great privilege for me to. And thanks. Thank you very much that you just invited me to join this excellent webinar. This really new concept. As you know about periodontology, it was flourishing last 20 years so much quickly that before we know only what is the pioneer alveolitis or something that related to only mouth, but nowadays it become related to almost all diseases of the body, even with the fatal diseases, with the periodontal diseases, as it is already established. And second thing is that now the new concept also comes about the gut microbiome. I think Professor Ajay, gut microbiome is related to almost many diseases and many conditions in the body that can affect. So the new concept always is coming. At the beginning, maybe it has some sorts of different types of criticism or many things, but we have to believe it, as because we have to go with the evidences, and we have to take the advantage of how to establish it. And really, dentistry is now become a total thing that not only in the mouth. So thank you, Professor Ajay, for giving us this great opportunity to learning something new concept, and also I hope that this will make changes in our minds of dentistry in Bangladesh, and it will. I think also I'd like to request our honorable principal here of Dr. Dhaka Dental College, Professor Bulbul, that sometimes he can try to just invite Professor Ajay to come to Bangladesh and just give us a workshop that will be much more beneficial for our dentists in Bangladesh. Thank you so much.
Right. Thank you, sir. You nicely mentioned to visit Professor Ajay Kakar to our country for his presentation and any conference. Thank you, sir, for your nice and excellent presentation. Now I would like to request Professor Jalaluddin Mahmood, sir, ex-head of the Department of Periodontology and Oral Pathology, Dhaka Dental College. Sir, would you please hear me?
Yes, thank you,
Yes,
Dr.
please.
Morshed Talukdar. And also thanks to presenter Professor Ajay Kakar for your nice and very informative presentations, and really it's a new concept, that is the occlusions, restoration of the perfect and correct occlusions, and the mandibular teeth follows the maxillary teeth, and these occlusion corrections and total jaw occlusion rehabilitations is related or incorporated to relieve the pain treatments, posture of the body. This also corrections causes relief of the pains for as a dentist or dental surgeons. So it's a new area, I think, arena for the dentist to discover this field, and we expand, I think, our treatment field, and even the medicine surgery where it's not perfect and not going 100% results. Your concept, that is correction of the occlusions and disharmony, and relieve these symptoms, and patients get benefited. Actually, we are really interested to learn more about this field, and if possible, we invite you to come to Bangladesh, and maybe we'll try, and our principals will request to arrange seminars or workshops so you can come and deliver lectures. We can share the knowledge directly. We can make with some idea and how you do it, and how the facial muscles, which one is activated whens, and how you diagnose it. We can learn it from just directly from you. And I also thanks to our principals, that is the presidents, teacher associations, and the secretary generals of the dental associations, Professor Humayun Kabir, and Secretary General Dr. Morshed Talukdar, to presence till midnight, beyond the midnights, and accompanying us and encourage us. And we are very thankful to all the panelists. Thank you, everyone.
Thank you, sir. Thank you, sir, for your excellent comment. You rightly mentioned our Honorable Principal Professor Humayun Kabir Bulbul sir, President, Dhaka Dental College Teachers Association, as well as General Secretary, Dhaka Bangladesh Dental Society, and also Principal Dhaka Dental College, may invite our Professor Kakar to Dhaka Dental College to arrange a seminar and attend a seminar in this situation. Thank you, sir. Thank you, sir, for your nice and excellent presentation. Now we are going to finish. Now I would like to request and thank you very much, our panel of experts, for your excellent and innovational comment in this regard. I would like to request to say something our
Sir,
coordinator. Dr. Kamrun.
Sir, I want to tell something, sir.
Sure.
Sorry, I am late. Sorry, sir, I am late to join due to some technical fault. I want to tell something, Ajay Kakar, sir. It was a very excellent presentation, and I enjoyed in every moment. I get very new information from this presentation. Thank you, sir.
Thank you. Thank you, Shonmi, for your nice and excellent comment in this regard. Now, I would like to request Dr. Anupam Podder, moderator of this seminar and head of the department, Associate Professor, Oral Pathology and Periodontology, as well as International Affairs Secretary, Dhaka Dental College Teachers Association. I'd like to request Dr. Podder to say something and give vote of thanks to this session. Then we'll go for our chairperson for the finishing of this program and his valuable opinion.
Can you hear me?
Yes, please.
Yes.
Sir.
Really wonderful presentation, Dr. Ajay Kakar, sir. I am really happy to invite you and in our platform. Very thanks. Thank you, Dr. Morshed Talukdar, Honorable Secretary General of Dhaka Dental College, Teachers Association, and eminent oral and maxillofacial surgeon. Though it is midnight, I will take few times for details our session and our periodontology and total Bangladesh condition. I will take some times. Today's topic is introduction to the aesthetic and functional basis of the Smylist concept. Dr. Maria from Budapest, Hungary, creates Smile concept related not only aesthetic but also related to functional components of dentition. Professor Dr. Ajay Kakar has demonstrated how an improperly placed mandible can be corrected and reverse the deleterious effect on the body. I give short history of periodontics in Bangladesh. I am the newly appointed head of the Department of Periodontology and Oral Pathology, Dhaka Dental College. Professor Dr. Abul Kalam Jordar sir is a pioneer of periodontics. I know Dr. Ajay Kakar also know him, and he's a Facebook friend of Dr. Ajay Kakar. He had working in our Mother Institute, Dhaka Dental College, lastly, and now he's very sick, and he's in dialysis in 3 days per week. And Professor Dr. Zahid Hossain sir, PhD, today's panelist, working as a periodontist in Northern University, Saudi Arabia. This is the main two person who is working as a periodontist in our country. Bangladesh is yet far behind than the neighboring countries because of the lack of periodontists here. We could not establish PG courses yet on periodontology. I am trying to hopefully reach our goal. If my principal helps me, I will reach our journey. I want you to proper help establish periodontists in Bangladesh for proper dental care of our poor countrymen. First of all, I would like to thank our Honorable Chairperson, Professor Dr. Humayun Bulbul, Principal, Dhaka Dental College, and President, Dhaka Dental College Teachers Association, who has given time to us. Though he was a busy man, and he tries to upgrade profession and our professionals. We are very much grateful to our honorable speakers, Professor Dr. Ajay Kakar, who is a busy clinician and have given time to us. Dr. Ajay Kakar is usually a private practitioner, but he is an adjunct faculty of MGM Dental College, Panvel, Navi, Mumbai. He is an editor of Illusions Journal. He writes a handbook on management of mobile and migrating teeth. He is the past president of International Academy of Periodontology. I am also would like to thank Dr. Professor Anirban Chatterjee sir, ex-vice principal, Oxford Dental College, Bangalore, India. He is an eminent periodontist. He is not only Indian but also a good friend of Bangladesh. I am very much grateful of and would like to thank Professor Dr. Zahid Hossain sir, Bangladeshi periodontist, but now he is working as a periodontist in Northern University, Saudi Arabia. Yet he is now in Saudi Arabia, but always help us and give us advice how we develop perio in Bangladesh. He is always thinking to develop us. I also to be thanks Professor Dr. Balaji Manohar, periodontist of Bhubaneswar, Odisha, India. He also the friend of Bangladesh. He has come Bangladesh several times in Badi program. Professor Dr. Jalaluddin Mahmood sir, an eminent professor of Bangladesh, he had worked as an ex-HOD, Periodontology and Oral Pathology Department, Dhaka Dental College. I also want to give thanks to him. Finally, I would like to thank our Nepali younger brother. Basically, he is a student of Dhaka Dental College, batch D34. He always feeds us and try to attach attend our program when we call him, that is Professor Dr. Manoj Humayun. Our moderator, anchor, has alone done their good job. Now I give thanks to Axis Dental School, my most favorite educational platform, who tries to develop BDS undergraduate course in Bangladesh by doing lecture in webinar by different faculties and different disciplines. I give thanks to my core of my heart. I think this webinar will be helpful to our professionals who learn more new things about occlusion and aesthetic relations. Thank you, everybody. Thank you, Ajay Kakar sir. Thank you all foreign panelists and our chairperson and our moderator. Thank you.
Thank you, Dr. Podder, for your nice and excellent comment regarding in this seminar. And as you know, this program is sponsored by Axis Dental School and organized by Dhaka Dental College Teachers Association. I would like to request our Honorable Chairperson, Professor Dr. Humayun Bulbul, BDS, DDS, PhD. I would like to request sir to say something in our seminar and share your knowledge.
Assalamu alaikum. Have a good night. It is very much hectic for me to wait 2 to 3 hours to say something.
It is a tough time to you, sir.
Tough time for me, but I enjoy it. It is such a webinar. I feel very honored to chair this webinar. It is very much memorable for me because today's presenter, Professor Dr. Ajay Kakar, honorable speaker, who is the leading private practitioner in periodontics in India, and also adjunct faculty, MGM Dental College, Mumbai. I express my warm gratitude to him from the point of Dhaka Dental College or Bangladesh Dental Society or Dhaka Dental College Teachers Association. I also express my thanks to all guests and panelists, as well as Dr. AFM Sarwar, Vice Principal, Dhaka Dental College, Moderator Dr. Morshed Talukdar, who is the Secretary General of Dhaka Dental College Teachers Association, Dr. Anupam Podder, Head of the Department of Oral Pathology and Periodontology Department, Dhaka Dental College, and Anchor Dr. Kamrun from Periodontics Department, Dhaka Dental College. Dear honorable panelist, Professor Dr. Jalaluddin Mahmood, ex-head of the Periodontology and Oral Pathology Department of Dhaka Dental College, Professor Dr. Muhammad Zahid Hussain, Department of Periodontology, Nazran University, Kingdom of Saudi Arabia, and Professor Dr. Anirban Chatterjee. By this time, he is our good friend. I enjoyed a few programs, few webinars, and sharing our knowledge with Dr. Anirban Chatterjee. He is the Vice Principal and Head Periodontics and Implantology, Oxford Dental College, Hospital and Research Center, Bangalore. And also Professor Dr. Balaji Manohar, renowned periodontologist and principal and head of the Department of Kalingo Institute of Dental Science, Bhubaneswar. And also Professor Dr. Manoj Humayun. I feel proud. I know that he is graduated from my institution, Dhaka Dental College, at 2003. We are proud, very proud of him. He is the head and of Periodontology Department, Kathmandu University, School of Medical Science. Also, here already linked, dear our honorable sir, Professor Dr. Abul Kalam Juardar, Professor Dr. Morshed Maula, Syed Morshed Maula, and other panelists, those who are engaged in this webinar, and all viewers. I express thanks to all. Though it is a long session, but it is what I say, this is absolutely an innovative idea. Because basically the changing our conventional thought about maxilla and mandibular relationship, and I am sure that we change our by these new treatment ideas, we change our many lives. That we know in modern society, a pleasant smile is an advantage in case of job interview, or in case of social interaction, even the selection of a spouse also. So, on the other hand, an unattractive appearance in childhood can lead to teasing, and it is continued up to the adult life also. So it is very much we get very much we are benefited from this webinar, and it needs huge webinar or huge discussion, or this sharing, this knowledge sharing is more updated as in future. So I request, after Corona COVID situation, in post-COVID, when we are in new normal life, of course, Dhaka Dental College arranged such a seminar or symposium where we are very much interested to invite Professor Dr. Ajay Kakar, not this virtual manner. Of course, we physically want to invite Dhaka, Professor Ajay Kakar, also other panelists, as much as possible we can try. So I have a limitation in Bangladesh in the point of professional view, what rightly says Dr. Anupam Podder. We are yet far behind about periodontology than that of our neighboring countries. So not only academic sharing is essential in case of periodontology, for us, we also, there is no post-graduation course in periodontology in Bangladesh. So we will be happy if all of our guests or panelists from abroad, those by sharing by which way we start our post-graduation course in periodontology in Bangladesh, by sharing their experience and advancement, the process of course starting in periodontology in their countries. So this avenue will discuss later on another webinar in COVID situation, or after COVID situation, we meet together physically and discuss everything. Thank you all. Stay blessed. Thanks to all viewers. Assalamu alaikum.
Thank you, sir. Thank you, sir, for your excellent and nice presentation.
Can I make one comment?
Professor Kakar, would you like to say something?
Can I make one small comment? One small comment. Balaji.
Sure. Balaji, sir. Professor Balaji?
Why don't we start a PG education in Bangladesh in Perio? Think about it. It's just a thought. We can do it.
I have already given the proposal to Dr. Anupam. I have said that I will be more than happy. So if you are going and helping them as a team, I have no problem at all. I'm more than happy to help.
We are all wanted to help them to come on. We are already discussed.
Dr. Humayun Kabir sir, I have met you before the 8th Badi conference. When I came, you gave a very fiery speech on stage. I was totally floored by your speech. I was so happy to listen to you. Please do consider, we are more than happy to help you start the PG education program in your college. And being the government college, I think you should take the lead and start it first.
Yes, that is what should be always done in government and college. Dhaka Dental College, it's a pioneer college and the parent college of Bangladesh. So I think that you should take the initiative to do it.
Okay,
Thank you very much, sir, for your nice comment. And
Yes.
and always
Yes, you rightly mentioned that Dhaka Dental College is the pioneer and only full-fledged government college in our country. So our principal hopefully will take initiative regarding this. Thank you, sir. Thank you all.
There is a Periodontology Society in Bangladesh, which is under the leadership of Professor Abul Kalam Zwarda sir, and
Yes, sir.
Secretary General is Professor Dr. I expect initiative to start a post-graduation course by Periodontology Society, and I will help as much as possible. I will try my level best to start this course with cooperation of our guest Professor Ajay Kakar and Balaji Manohar, Anirban Chatterjee, and also from Manoj Humayun. Their cooperation will help us. Bangladesh Dental Society along with this program, and it is initiated in Dhaka Dental College, of course.
Thank you, sir. Thank you. You are very much.
Professor.
Thank you,
sir. Really, I am really thankful. I am really thankful to you. Though I am far from here, Dr. Anupam, he always keeps communication with me, and we have regularly we just talk, and we are really sometimes we feel that yet we are far behind from neighboring countries, but we have to start at any cost as early as possible. And I'm really thankful to our honorable principal, Professor Dr. Humayun Bulbul. He is also our leader of our national society, Bangladesh Dental Society, and he is very popular among all through our dentistry profession in Bangladesh, and he is very much active for, as I know, because I know him from my student life. He is a little junior to me, maybe 2 years. Anyway, thank you so much for reminding me and inviting me every time for your webinars, and I'll be always happy. Maybe for some reasons I'm outside of the country, but maybe I'll try to return home soon. And hope to just work together bodily. But yet I am far from you, but it is now easy we can communicate as Professor, our friends from neighboring countries, we can communicate easily online. So if you really want to do some, Dr. Anupam, so take initiative and we will be with you for making the course curriculum and how to study. We can think and we can just make the planning for this. So we hope for the best. Thank you so much.
Thank you, sir. Thank you all. I'd like to thanks to Axis Dental School for sponsoring this webinar, and thank you all our panelists from home and abroad. Thank you our honorable principal and Secretary General.
Yeah, they are moderator, sir. But I would like to request Professor Dr. Ajay Kakar sir to say something about Bangladeshi platform and about our periodontology and about our how we run our subject. Please.
Well, thank you very much, Anupam. It was a great experience. I enjoyed it, and I'm glad that all the people are here. I hope that we had a good number of people who were there on the live feed also. And I'm there to answer any questions. And the panelists were lovely. Of course, Balaji and Irfan, Manoj are all lovely friends for a long time. It was great to have them interacting over here. And Balaji came up with those articles before you could know it. Just brilliant. Everything was great. I enjoyed it thoroughly. And what I can say is that I can get you an endorsement from the International Academy of Perio, since I'm the past president now, for any program, Perio training PG program in Bangladesh. That is one of the charters of the IAP, and I would be glad to help in every way from on behalf of the IAP to ensure that Perio education gets a firm footing in Bangladesh.
Okay,
Thank
sir.
you.
Thank you.
Thank you.
Sir.
It's
And very much
already
grateful to you.
midnight. So thank you all and good night.
Good night.
Thanks.
Thank you, sir.
Good night, sir. Thank you, sir. Good
Thank
night,
Thank
sir.
you very
Good night,
much.
sir.
And
Thank you,
lastly,
everyone, sir. Thank you, Balaji, sir.
lastly, I'd like to thank Anupam Podder for organizing such a good and wonderful seminar. Every time
Thank
webinars,
you.
he has been the pioneer in doing, and even the principal, sir, Professor Humayun, Kabir, Bulbul, sir, who has been always in the forefront and always dynamic young person leading the way.
Thank you, sir.
And we as Vice Principal Sarwar, sir.
Thank you, sir.
Thank you, Dr. Ajay.
Thank you, sir.
Namaskar.
Thank you.
Namaskar.
Thank you,
Good night.
everybody.
Good night.
Shubharatri.
Shubharatri.
We can shake hands.
Good morning for the next day. Very good morning for the
Thank you,
next day.
Balaji.
Yes.
Thank you, sir.
Sir, thank you.
Bye, everybody.
Thank you. Bye, everybody. Bye, sir. Ajay,
Bye.
sir.
Bye.
See you.